Joining us now to take a look at a medical question from one of you. This one's from Kathy H. She's asking, what foods should I avoid as someone who suffers from anemia?
It's such a good question. We often talk about foods you should take. So we'll focus on the most common cause of anemia, which is iron deficiency anemia. So what foods do you want to avoid that block your ability to get iron? Number one, dairy. A lot of calcium in your diet can suppress your iron absorption and lead you to being more iron depleted. So if you do have iron deficiency anemia, you want to make sure to avoid excessive amounts of dairy. Also, chemicals called tannins. You can find these in things like dark chocolates, heavy amounts of coffee. That also suppresses our ability to red wine. I forget that you're a chemist on the side. Red wine as well, absolutely correct. Excessive amounts of those products can decrease our ability to absorb iron. And then alcohol. It decreases our ability to create new red blood cells. And so if you have anemia, you want to make sure to avoid alcohol.
Got another question from a viewer. Hannah B wants to know, how is osteoporosis diagnosed?
That's a great question. Many people get it confused between regular arthritis, rheumatoid arthritis, other bone density problems. So osteoporosis most often gets diagnosed via something called a DEXA image. It's a special type of x-ray. Often we do it on the hip, for example, or the spine to understand the density of the bone. It's recommended that women over the age of 65 talk about getting this screening exam because it can lead to increased fractures. A fracture in the spine or the hip can be debilitating and affect your quality of life, so making sure that if you know you're at risk, to be able to prevent that. Also, those who might use steroids, for example, corticosteroids or heavy use of steroids can decrease your bone density, so you want to make sure they get that scan early. And if you have a history of diabetes or if you smoke, those are all risk factors that increase your risk of osteoporosis, so you should check.
Your prescription for wellness?
My prescription for wellness is on taking care of your feet. Over the weekend, I was working in the emergency room, and for some reason this came up often. And so I feel like it's really important to talk about how we can take care of our feet. Don't ignore those dry heels. Don't ignore those cracked heels because it can debilitate you and cause increased risk of infection affecting your gait. And so my prescription for wellness is how we can fix that. If you notice that you have dry skin, you can start by soaking your feet in plain soapy water for at least 10 minutes. And then you can use a pumice stone to exfoliate, pat it dry, and then moisturize your feet. Also, trim your nails regularly. This helps to prevent ingrown nails and reduces the risk of infection. And remember, the best time to trim is after the shower when they're soft. And remember to cut them straight across and leave your cuticles alone. Also, choose the right shoes. We were talking about this, Eva. Be sure that the shoes that you spend the most time in are comfortable with wide toe beds and enough support to support your arch. And then remember when you need to visit a podiatrist. It's recommended that adults living with diabetes visit a podiatrist at least once a year. And if you have increased pain or calluses or ingrown nails, make sure you get it done with a licensed professional and avoid trying to do aggressive things inside the nail salon.
So you dealt with a lot of feet this weekend?
I dealt with a lot of feet this weekend. Sure did.
Folks, take care of your feet so you don't have to go see Dr. Darien.
But if you need help, I'll be there.
Thank you very much. We appreciate it. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions at ABCGMA3. I could have had a lot of fun with that, but I'm just going to be very nice today.